Hello, and welcome to Autoimmune Voices, Threads of Hope, where we bring real stories and insights to help people living with autoimmune disease become informed, empowered, and connected. I'm Molly Murray, President and CEO of the Autoimmune Association, and I'm so glad that you're tuning in today. Our guest is Becky Hosey. She's both a physician assistant and a chiropractor, and she also lives with an autoimmune disease, bringing a unique perspective as a patient and provider to today's conversation. About 10 years ago, Becky's life changed dramatically when she was suddenly developed severe fatigue, weakness, and pain. But what compounded her situation was the way that she was treated when she went to go get help. Doctor after doctor dismissed her symptoms. Eventually, she was diagnosed with Sjogren's, but only after fiercely advocating for herself. Today, she uses that lived experience to help bridge the gap between patients and providers. She's working with us here at the Autoimmune Association to educate healthcare professionals across the country so that autoimmune diseases are recognized and treated sooner. We're thrilled to have Becky here today to share more about her journey to diagnosis and the lessons that she has learned along the way. So Becky, thank you for joining me today.
Oh, thank you so much. This is a great honor. I so appreciate being here today with you, Molly.
And we so appreciate you. We've certainly done a lot of work together these past couple of years, and it's really important work that we'll dive into today. I think, as we get started, I would really love for you to share, how you got into your healthcare profession. You certainly bring a unique perspective today as a physician assistant, as a chiropractor, as I mentioned on the outset of my remarks. And you live with an autoimmune disease, but what kind of got you into the healthcare profession to begin with?
Sure. So, I always knew I wanted to be in a helping profession, and I liked science. And interestingly, my mom had a bad back. She was a hairstylist, and she would take me with her to her chiropractic appointments when I was a kid. And, I actually ended up in a car accident when I was a teenager and went to her chiropractor for some issues with my neck. And I was really intrigued by this profession, how, okay, without the use of medication, patients get better and respond to these treatments. So I decided to go to chiropractic college. And then I graduated and I was teaching. I was actually doing some teaching at the graduate and undergraduate level, as well as practicing as a chiropractor. But I realized my scope of practice was fairly limited, and I wanted to be able to provide more services to patients. So interestingly, I spoke to some chiropractors that went to physician assistant school, and I decided to take the plunge to do that as well. And I graduated in 2009 as a PA, and really most of my experience has been in musculoskeletal medicine, also academics, because I believe strongly in teaching, especially to better the profession. Really just enjoyed just working with patients and providers, as a team, and just really trying to help others.
I love that, and certainly something that is so valued, right, to patients when they come in to see their practitioner, is having somebody on the other side of the conversation who wants to be there and enjoys, of course, what they're doing in the field that they're in. Can you take us back then? I believe it's 10 years ago now, right?
Yes.
What was happening in your life at the time? And when you first started experiencing symptoms, can you share a little bit about what was happening then?
Yeah, absolutely. So 10 years ago, my family and I recently relocated back to the capital region of New York, about 8 months before I got sick. I was working in interventional pain medicine at a hospital, and really just adjusting to life in the area here. This is where actually I went to college in Albany, so familiar, but now working as a professional, obviously. And my son had just turned 5 years old. We were building a house, so there's a lot going on. The construction of our house got delayed, so there was some stresses there, and obviously just adjusting to our new lives. And I ended up actually in February of 2015 just experiencing an acute onset, so a rapid onset of fatigue, muscle weakness, and joint pain. So in that order of severity. As a healthcare provider, obviously, we don't really like to take time off, reschedule our patients to become a patient. So, we try to deal with a lot of things at home, many of us, all right? I can't speak for everyone, but so after a few weeks of these pretty significant symptoms, I mean, it felt like I had the flu, but somehow I knew it wasn't. And those were the three big ones. But I also had dryness. I had a dry cough. I had dry eye. I had dry mouth. I had these dry patches of skin that looked like red sandpaper, especially on my face. It was really disconcerting. And I also had abdominal pain, fever. So I had this laundry list. But really, the big three were fatigue, muscle weakness, and joint pain. So I, put up the white flag and called my own practitioner, who I had only met one time. So because we had just moved to the area about 8 months prior, I met her maybe about 6 months before this time, just to establish. So this is my first really sick visit with this provider, this primary care provider. And when I went to the appointment, she basically said, I think you have just a virus, and gave me the typical self-limiting illness, something that's going to resolve on its own type of directions, rest, fluids, supportive medications, like ibuprofen, Tylenol, etc. I think she even gave me an inhaler because I had this cough. So really, I was told, call back if you're not better. But when I did call back a week or two later and said, I'm not better, I need to come back in, I was actually met with contempt and not compassion. So she questioned me, and it just really, that was the start of just this realization of gaslighting. She questioned me and said, did you follow my directions? And I'm thinking, oh my goodness, really? Like I had to, again, reschedule my set of patients today to come in to be seen. I'm not going to waste your time here. I'm not going to waste my own time, getting cold treatment. I'm sitting on a cold examination table, but I'm getting even colder treatment. I didn't understand.
Mm-hmm. Right. I think, a couple of thoughts there. One, as a healthcare practitioner, did it cross your mind? Did autoimmune disease cross your mind at this point, right? This is early on, number one. And then number two, I think, having that experience, right? I think for so many patients, it can be so exhausting, to look for a diagnosis. And, you talk about this experience of pain and fatigue and how this is impacting your life. There's also that mental component of it, right? So you've got this physical aspect that's going on. Can you speak a little bit about, not only did autoimmune disease occur to you, but then when you kind of get into this doctor's office and you have this exchange, what that felt like to have that with a fellow practitioner, right? And how that impacted you kind of your like mentally and emotionally having that experience.
Sure. So in the very beginning, I wasn't truly thinking autoimmune. I actually thought it was some type of obscure virus of some sort, in the very beginning. But as time went on, I was very suspicious. And I just want to say I had to actually push this practitioner to order tests. Like she didn't even want to order tests. So, in the first 6 months of this illness, 100 tests were ordered. Okay. So I was pretty certain that it was an autoimmune condition by like month 5 of this. So, and I'll tell you why, because we had ordered so many tests, and she did order a few autoimmune markers in the beginning. So like an anti-nuclear antibody and a rheumatoid factor. When those come back negative, she didn't want to refer me to rheumatology. She actually said it's a waste of time. And I said, well, these tests can change over time, which I know from my medical education. Also, my uncle died of complications from lupus when he was in his 50s. So I started thinking I really had lupus, probably from month 4 or 5, I was really thinking that. So the emotional impacts, first of all, it was shocking. It was absolutely shocking. And I really felt very betrayed. I just could not believe that I wasn't even afforded a fraction of the compassion and empathy that I give my own patients. I just could not believe that. I do think that this practitioner had a lack of just general knowledge, okay, which led to the gaslighting. I do believe that. But it was very difficult. It was a vulnerability that I never experienced. So yes, I know medicine, I know the science, but I did not understand the psychosocial impacts of illness, the vulnerability of illness. I did not get that until I got sick in 2015.
And it is such a big component of it all, right? I think when you are in a vulnerable situation and you're looking for help, there's so many things that I think can take a mental toll on going through this journey, just dealing with the physical symptoms, and then of course being compounded, with a lack of receptivity. And I think that certainly your story demonstrates that, and what can happen, just kind of mentally and emotionally, when that takes place. So these tests come back, right? And that's sort of the first step interaction that you have with a healthcare practitioner, and you're not getting the answers that you need. And I think, one part of your story is the self-advocacy that you engaged in to get answers. So here you are, you have this initial visit, you're armed now with some tests. What is the next step that you take, because you've had this interaction and you're not getting the help that you need?
Sure. I should mention too that my tests came back very similar, meaning that the inflammatory markers were high. At one point, my erythrocyte sedimentation rate was almost triple digits. It should really be less than 20 for most labs. My platelets were high. My white counts were up and down. So I had this picture of this chronic inflammation going on, but this provider was still dismissing me. So I asked her for referrals. I actually saw 10 different specialists before I saw rheumatology. I saw hematology oncology, I saw pulmonology, I saw gastroenterology, I saw neurology. Okay, so the list could go on here. But so I really just, when this provider refused to send me to rheumatology, I actually called up a local rheumatology office myself and definitely gave the receptionist a little too much information about my life. There may have been some tears involved too. I basically was probably frantic on the phone, even hysterical. Like, I'm a physician assistant, I'm sick, I'm having trouble working, I'm falling asleep at the wheel because of, being so fatigued. I can't stand to make a sandwich or play with my son. Need help walking to the bathroom at times. So, I'm explaining all this, and I have these positive markers that show I have inflammation. We don't know where it's coming from. There's something going on. I've seen 10 specialists. I need to come in and be seen. So I did get an appointment without a referral. I don't know if that would fly these days, but it did 10 years ago.
Good for you for being persistent and getting in there.
So yeah, I don't know, but I, gave enough information that I got the appointment. So I saw rheumatology month 7 of this illness. But unfortunately, the rheumatologist I saw was actually more dismissive than the primary care provider, if it can be even, yes, even imagined. So she didn't want to order any tests. She told me they were not necessary. She told me to follow up with gynecology and gastroenterology, and I said I've already seen them, and basically was ready to walk out the door. So here's where the advocacy comes in, and thank goodness for my medical education. I had several months to prepare to before actually arriving at this appointment because of the waits. Although now it's even worse. I've heard some patients say it takes 2 years to get into rheumatology now. So I only had to wait a few months. So, but during that time, I prepared myself, and I had a binder full of my medical records. I have things in chronological order. I had things tabbed of what I thought might be important. I had 2 index cards. One of them had my symptoms, and it was filled front to back. Okay, just to let you know how many symptoms I had. Okay, and then the other card had lab tests that were necessary in order to rule out certain diseases, which correlated with my symptoms. So this provider was so dismissive to me. I basically took these 2 cards and I just kept going down the list. I mean, I was fierce. I wasn't rude or belligerent. She was talking over me, so I did have to talk over her, but that was the only way that I could accomplish this. I said, I need this test because like I need an ANA. My uncle died from complications of lupus. I have these symptoms. I have a picture on my phone of a, butterfly rash on my face. Like, I need this test done. So of course the answer was on the card. I just didn't know it at the time. So I wore her down, and she decided I wasn't probably leaving without a lab order. So she, at the time, it was paper, and she circled. So she was like frantically circling all these lab tests. And I thought, hey, let me just keep talking. Yes, I need this test done. And I think she was just doing this to appease me. So she told me no follow-up is necessary because the labs will not show anything. That's what she told me. And actually wrote on my checkout paperwork in all caps, no follow-up. So, but Molly, she handed me the paper, but I didn't feel vindicated at that moment. I actually felt very sad for all the patients that I knew couldn't advocate like I could. I have this medical education. This is probably this provider's usual routine. Okay, a female complaining of fatigue, invisible symptoms, right? Fatigue, muscle weakness, joint pain. Okay, so I felt very sad at that moment.
Yeah. Do you think, gosh, I have so many thoughts about this, because you bring up a really important point. I mean, here you are, you're a healthcare practitioner, right? You're trained in medicine. And so you're in there and you're able to truly advocate for yourself in a way that maybe some others aren't able to do. And I think about all of the patients that are out there that are going through this and maybe don't know the test to ask, or the questions to ask, or even consider autoimmune disease. I mean, if there's a couple of takeaways that you could give patients writ large who don't have medical background, what is it to come into that office and advocate for yourself, regardless?
Sure. So yes, I started talking in the medical community, or in the general community, trying to educate patients to self-advocate for themselves. And I feel very strongly on this. So the number one thing that I can say, a tip, would be to be prepared for the visit. And if you don't have the medical knowledge, I mean, almost everyone knows a nurse or, someone working in the medical field. Reach out to them and explain the situation, have them help you come up with questions. Walk in with those questions, have them ready to go. There's so many medical constraints that time with our provider, face-to-face time, is very limited. So we have to make that as efficient as possible. And so reach out, get help, journal your symptoms, be very specific about it. So don't just say joint pain. No, when does this happen? Be very, very specific. Are you doing anything during this time? Or if you have stiffness in the morning, how long is it lasting for? So be very, very specific with this. Try to bring a friend or a guest, as long as obviously infectious protocols are not putting a stop to that. Bring someone. Let them take notes while you're talking to the provider. If the provider is dismissive, it's okay. Politely redirect them. So they may be a lot of times staring at their computer screen, typing away, right? So providers have a lot of administrative duties, and they may be concerned about trying to get this note done, right? The documentation done. But it's okay to say, can you please stop typing? This is very important. Can you please focus on me? That is perfectly acceptable. And sometimes, again, I do believe most practitioners go into medicine for altruistic reasons. I really do believe this. There's the medical constraints that, impact this patient-centered care. So it's okay to, give a little reset to the provider. That may just be like, oh yes, I should be focusing on the patient right now and not looking at my notes,
Yeah. I think that's, first of all, those are all really good pointers for anyone who's visiting a doctor, healthcare provider under any circumstances, because time is limited, right? And so the more that you can come in prepared for that conversation, know the questions you want to ask, having, track your symptoms, like you said, when it's happening, bring somebody with you. So they also hear, maybe they pick up on some things you don't or might miss in the meeting, and kind of redirecting the focus while you're there. All really, I think, helpful tips for anybody who is going through this. I want to get back to in a moment how your journey came full circle. But kind of along these lines and what you were experiencing, because now you've been to 2 doctors, right? And you're not there yet, right? You're not there yet. Come back to your next step and how you kind of came full circle with your eventually getting to a diagnosis.
Sure. So yeah, so this rheumatologist ordered those labs, and again, just said no follow-up. The labs aren't going to show anything, which was completely ridiculous for a provider to say that to a patient at any point. So I had the labs done, and about a week later, I got a notification from the laboratory facility. And I remember I was too sick to work that day. So I was home. I can tell you exactly where I was. I pulled up my laptop at the kitchen table and I logged on to my patient portal. That's the other thing I'd like to say to listeners. Make sure you have a patient portal, not just with your provider, but also with any lab facility or any type of radiology facility that you go to, because unfortunately the way medicine is, you can easily fall through the cracks. So you want to make sure that you get those results, even if you don't know what it means. That's okay. It's still a check and balance, meaning that you want to make sure the provider got those results, right? Because I've been a provider and haven't gotten results that patients have called me about, and they haven't sent them to me. So this happens. So again, just a sidebar there. But as I'm scrolling through these results, I'm seeing the usual inflammatory markers high, my platelets were high, my white count was high, my immunoglobulins protein high. So, and then I get to some of the autoantibodies, and I see a red flag over the anti-SSA antibody. So this is a new finding and suggestive of primary Sjogren's disease. Mm-hmm. So to me, it was like, whoa, again, one of those moments, you remember where you're at.
Right.
So this was new, and I thought, well, this is a smoking gun. Mm-hmm. And really my symptoms all matched with the disease. So I really just said, oh my gosh, what am I going to do now? I don't have a follow-up. This woman told me I would not have any positive lab tests. The lab test would show up.
Here you are with
so what am I going to do? So I called the rheumatology office back. I didn't talk to the same person that I talked to originally to get the appointment. I knew that. But I explained to this receptionist, like, I do not want to see this provider ever again, but I need to see someone. So can you give me an appointment with another provider? I have these positive tests. I have significant symptoms. I need to come in and be, talk to someone about this. I want to get treatment, trying to get my life back together. So she said a nurse would call me back. That was how the conversation ended. So a little bit later, I got a call, and it was actually from the rheumatologist herself. Now, I'm quite sure she forgot who I was, okay? She forgot that whole encounter from the previous week, okay? So she said, well, you called? And I said, yes, I have these positive antibodies for Sjogren's. And she said to me, there's no way you have that disease. And honestly, I was not expecting any compassion, any empathy. I was not expecting any of that. But Molly, I was expecting that. We're two scientists, and this is objective data to look at. So right. We're interpreting objective data here. So I have this severe chronic inflammation going on, and now I have positive autoantibodies for Sjogren's, and I have all the symptoms. So she told me that the level wasn't high enough for her to diagnose me. And I said, well, it's 4 times the normal lab limit. Do you not trust the lab? Like, I'll go to another lab if you want to go, but I would have no problem going to another lab to get this retested. And she said, in her opinion, it would have to be 7 times higher. And I said, oh my gosh, wow. I was stunned. Okay. Again, wasn't expecting any empathy, but I was just stunned. And I said, well, can you order this? And she said, it's too early. We'd have to wait 6 months. And I said, I can't function. Mm-hmm. I need answers. I cannot function. Like, I'm not working regularly. We're building a house. Like, I can't afford to have the mortgage on this new house that we're building. I need to get back to work. And obviously, the social impacts and the physical impacts of needing help to walk to the bathroom and not being able to drive and things like that. And she hung the phone up. She said, sorry, call me back in 6 months, and hung the phone up.
Wow.
I was stunned. I was stunned. I could not believe this. So I felt like I was in a twilight zone. I immediately, had my laptop up and I started searching for facilities, the best facilities, in the Northeast for, for specifically for Sjogren's. And I found Johns Hopkins, also the Cleveland Clinic, which is about 7 hours from my house. And there's a Sjogren's clinic at the University of Pennsylvania in Philadelphia. So I called all of them. The first appointment I got was at the Cleveland Clinic. I had to wait a little over 2 months, like 2.5 months. So I just had to hold on until then. And then the University of Pennsylvania appointment was like 3 months or a little bit over 3 months. So in the meantime, I returned back to primary care, and she told me that she's never seen a patient with Sjogren's that has more than dry eye and dry mouth. She's never seen fatigue, never seen joint pain, never seen any of the systemic symptoms. And I said, well, I looked it up, and I actually brought her literature, like peer-reviewed articles, and she would not take them from my hand. I actually was trying to hand them to her to educate her. So she took that as a personal attack.
Wow. Why do you think, do you think that there is having had these experiences, right? Do you think that there is a particular blind spot when it comes to diagnosing autoimmune disease, or where do you think maybe some of this resistance was coming from? You mentioned maybe lack of knowledge, or having not seen symptoms that you were experiencing. I think, is it because, and we talk about this a lot, the Autoimmune Association, there's so many overlaps in symptoms where it can be a lot of things. But what are your thoughts on maybe where that pushback was coming from? Or do you see sort of just a blind spot when it comes to diagnosing autoimmune disease?
Oh, so how much time do we have?
Much is fine.
All right. So, so let's condense it down here. But so there's many layers to this. So let's just uncover a few here. So first of all, we know that 80% of those with autoimmune disease are female. So these are female dominant conditions for the most part, right? We know there are some exceptions, but for the most part. So we know autoimmune disease is female dominant. It's no secret that female dominant conditions are poorly studied medically. Okay. Poorly studied. And so again, we have these knowledge gaps with providers. So I just like to say kind of, and again, we have these complex symptoms, right? So we have these head to toe, kind of this large array of symptoms, and some of these symptoms come and go, right? They come in flares. Mm-hmm. So it's hard to nail down sometimes. So add in a mixing bowl, basically, say a female complaining of invisible types of symptoms, fatigue, pain. Those are the number one and number two symptoms that are shared among many autoimmune diseases, many. So add that to the mixing bowl. So throw that in. Now add medical constraints. So add a provider that's stressed because she's seeing too many patients. She has all this administrative work. She's dealing with insurance companies, and she has a lack of knowledge. So this is a real setup for failure, and it's a setup for medical gaslighting, because it's easier to say, like, dismiss a patient. I just, would rather dismiss a patient than investigate. I don't have time to investigate. I don't have the knowledge to do this. I mean, but really, when I speak medically, I remind providers that we still have a responsibility. If we can't figure this out for the patient, we have a responsibility to get them to someone who can. Right. Okay. So we have this responsibility, but it's just easier to dismiss. And unfortunately, there's a societal component to this as well. So, things that are happening in society are also happening in medicine. And so there's also that as well. There's intolerances and such like that, and different viewpoints that all are in this mixing bowl. And again, a setup for failure. And that's what happened to me.
Right. So many components to that, so much to sift through. It's almost the perfect storm, to end up in this situation, which certainly, which is why provider education, I think, is so important, which I want to get to in a second with you. You're still in this journey.
Yes.
So take us to kind of the last phase of this, when you finally get your diagnosis.
Sure. So the Cleveland Clinic. And so that was 9 months, almost 10 months into this illness. So by the time I arrived at the Cleveland Clinic, I was seeing a general rheumatologist, a very lovely gentleman. I had, this huge binder of my medical records. I not only had the cards were out the door; those were okay, history. All right, so actually, I still have one of those cards, by the way. I found one. Anyways,
A little memorabilia.
Exactly. I typed up a very detailed timeline. I mean, so detailed that it said my symptoms, even on certain days, and I would try to, call this primary care provider and get labs when I was feeling terrible, because I knew the labs can change over time with autoimmune disease. So I was feeling terrible. Went, my sed rate was, 60 or 50 or whatever it was. And my white count was this. And I also wrote in there about specialists that I saw and what their recommendation was, their names and, telephone numbers if you wanted to contact them. And, so I had pages of this, right? So I walk in and see this gentleman, and I had a copy for myself so I could quickly reference it as well. And I handed him a copy. And so he quickly sifts through this and kind of gets to the end where the autoantibodies, and by that time I'd already seen ophthalmology, and they confirmed that I had dry eye, which was consistent with Sjogren's and such. So I'd seen all these other providers, and he said, well, what can I help you with? And I said, well, I'm here for a diagnosis. And he said, you already have one.
Wow.
I'm sorry you drove 7 hours to come in. And I said, no, this is, it was obviously a relief, but something you don't want to hear, which is that you have an incurable disease. The other component I want to just mention about him was he probably said one of the best things to me. He said, I really strongly recommend that you see a specialist who truly understands Sjogren's. He said, because there's a lot of misunderstanding within even the rheumatology community, never mind the medical community. So I shared with him about my visit with the first rheumatologist I saw, and also about the primary care provider. And he said they just don't understand this disease, even though it's common. It's the second most common rheumatologic autoimmune disease. But he said it's just not well understood. It's not well studied. That's what he told me.
So that is, that's incredible, because you've gone now how many months, looking for a diagnosis. You've got, again, you're a healthcare practitioner. You've got this binder full of information and tests and all of this, right? And gosh, I just think about patients that are out there, and we touched on this earlier, that don't have that degree of knowledge, and how important it is to do what you can to get there, to be prepared and be persistent to finally get to that diagnosis. And I think your story just embodies that so well. You didn't give up, you kept going, and you finally got to somebody. And I think that's part of this journey. It's getting to somebody who can help, who understands, who listens, and can get you on a treatment plan and believes you. Sometimes that's half the battle, and we hear that with patients a lot that we talk to, that kind of knowing something's not right, staying the course, sticking to it, because eventually I think, gosh, you're persistent enough, and you'll get there, and you'll find somebody who believes you and understands and is listening. And I just think that is such an incredibly powerful and important message. And I'm sure for you it was such a relief, as you said, gosh, you don't want to hear that you have this chronic illness, but to have somebody say, I believe you, and validate and say, look, you've got this, gives you a place to go, gives you strategies to put into place, and gives you a path forward. And I commend you for staying the course, and what that means for other patients and providers who are listening, to help patients with these nebulous symptoms that are tough to sift through. How important that is to the future of people's lives and to their health. So I just commend you for that. You're now working with us. You've taken, kind of your lessons learned, and you're now working with us to help educate providers on diagnosing patients, so that with autoimmune disease, so that they can get to diagnosis and to treatment sooner. And I think we talked a little bit earlier about so many healthcare providers, of course, go into it for altruistic reasons, and they're talented and they want to do the best for their patients, but may simply not have the knowledge or understanding to diagnose an autoimmune disease. And so you've been talking with providers to kind of help with these conversations and using your lived experience as a patient and your knowledge as a provider, and your story to help spark these conversations, and again, hopefully get patients to a quicker diagnosis and treatment. Can you share with us the messages that you've been sharing, and what kind of feedback you've been getting in these conversations to date?
Sure. First of all, it's such an honor to be partnered with the Autoimmune Association, with the intention of expanding awareness and education among medical providers, because I truly believe that we can focus on education and awareness with patients, but unfortunately, they're still going to run into roadblocks if we don't reach medical providers. And yes, I have this duality. It wasn't my plan in life, but it kind of, fell into my lap here. Okay. It wasn't my plan, it did 10 years ago. I was like, oh yes, let me do this. So, but really, and people often ask me like, how do you talk about this? Like, it's so painful, but if I don't, then there's not going to be any positive impact from this for patients or providers to try to change, and yes, lessen this time to diagnosis, which is so crucial in order to get treatment. But yes, so we really, one of the, some of the key points from this education program, yes, we want to talk about the challenges to diagnosis. We want to talk about the complexity of symptoms and kind of like, we want to talk about some of those symptoms that are shared between, many different diseases. We want to talk about assembling, the clinical picture. So helping providers, just giving them tips, like how can we, how can you assemble the clinical picture? Really a big one is to have this be on your radar. Autoimmune disease has to be on the differential diagnosis list for a lot, in a lot of circumstances, especially for females that, keep, coming in and stating they have kind of these nebulous complaints. Really, I want to just say this, providers are very vulnerable. They're vulnerable as well when they don't have the information. So again, just empowering them, letting them know, yes, we understand there is a lack of research, but hopefully we can help kind of bridge the gap, some. And that's really it. We talk about etiologies, we talk about, some of the newer treatments. So, this idea of precision medicine, and really the feedback has been so overwhelmingly positive. Providers know that there are these gaps and they want to know what to do to help their patients. And that's been so encouraging, so encouraging. They want these conversations.
Yes, absolutely. I think there's such a desire out there, a need out there. And I think we've all been, feel this sort of positivity around these conversations because it has been received so well, and I think it just speaks to a need and receptiveness. I think it's just a lot that we can continue to build upon, because we're all in this together, right? Patients, providers, we're all looking for a positive outcome here, for patients. And we want providers to be as successful as they can be at this. And we just thank you so much for helping us have, spark these conversations, pushing us to have these conversations. And I think it's only going to, get better over time. I guess, if there's, kind of final thoughts on, what you would like to see, and you've touched on some of this, but what would you like to see change sort of in the medical training setting so that providers can recognize and treat earlier? Is there one or two things or some takeaways you've got there that you really see in these conversations as a need, and maybe changes just in sort of medical training overall?
Sure. I think the main core of this is more research. The main core of this is more research, because without research, textbooks are going to be limited. They're not going to have the information. I can tell you many medical textbooks on Sjogren's, they're really lacking, okay, really lacking. Some don't even mention systemic symptoms. So, and that's just for one disease. So, so the core of this, the core of fixing, or, really the core of impact is education, or education, and really through research. So just we have to get more medical research. We absolutely have to get more funding for these diseases, so that way our providers can be better educated. There's also a component of humanities, medical humanities. Okay, so I think some medical programs, obviously they don't put an emphasis on medical humanities, but I think that's very important. So we have to believe our patients. So we don't know, we're not in someone else's body. So and we may have a million other things going on. We may have all these constraints, but still we have a responsibility to this patient that's sitting in front of us. Mm-hmm. So just always keeping that in mind. So again, there may be all these other side things happening, but we have to keep the patient in the center of care.
Yes, absolutely. Couldn't agree more on all of those points. And certainly, you touched on the research element of this as well. With so many of these conditions out there, my gosh, man, do we need treatments? And I think when those treatments come about and the research is happening, hopefully this is a completely different conversation that we're having together in 5 to 10 years. Becky, I can't thank you enough for being here today, for sharing your story, for your honesty, for your vulnerability in this conversation. You are doing really incredible at a work here with us, and just generally to change the way that autoimmune diseases are treated and understood. And we can't thank you enough for that. So thank you for being here today.
Thank you so much. And thank you for all the work you're doing, all the amazing work to really just impact all the 50 million Americans and more throughout the world. Thank you.
It's our honor. Thank you so much, Becky.
Thank
all
you.
Right. Thank you everyone for tuning in. If this episode resonated with you, I welcome you to please share it. And if you're looking for resources, community, or ways to get involved, please visit us at autoimmune.org. And lastly, don't forget to subscribe so that you never miss an episode. And thank you very much for being here. We'll see you next time. Take care.